Hey everyone, my name is Dr. Trina Mann. I am a doctor of physical therapy and I have my specialty in orthopedics. I wanted to hop on today just to do a quick short video. One of the things that my friends and I, who are also physical therapists, were talking about after work yesterday kind of incites a little bit of fear or concern into us as physical therapists when we're taking movement classes is when a movement teacher asks, is anybody in the class injured? Because most of us in adult bodies will sustain injuries of different varying chronicity, varying intensities over the course of our adult life, or maybe even the course of our childhood as well. And it's really important that all of us work with, if we need to, a movement specialist one-on-one to have a rehabilitation process. That cannot happen at a classroom level. Okay. So it kind of concerns me. I was thinking about it today when a teacher says, is anybody in the class injured, for a couple different reasons. And I just wanted to outline those reasons. So the first reason is, what is that teacher supposed to do with that information? So say you are in a Pilates class and a teacher says, who in this class is working with an injury, and maybe 3 of the 8 people in class is dealing with back pain. Does that teacher, if the students share that, does the teacher know what to do with that information, right? They could have 3 people in a class that have, one of them might have low back pain due to a spondylolisthesis, right? Where their vertebra's migrating forward over time. Somebody else might have low back pain because of a herniated disc. And another person might be experiencing low back pain because of a muscle strain or because of stenosis or something else going on. So all of those conditions should warrant slightly different movement choices, movement protocols, observations. And people that are dealing with those injuries really need to come to a fitness class knowing how to make modifications, right? And that happens when hopefully, that happens when they're in rehabilitation with people like us, with doctors or of physical therapy or physical therapists who are helping them understand where they're sensitive, what movements they're sensitive to, and how to modify within a class setting to avoid that. So the first thing is, what's the teacher going to do with that information, right? The second reason why I think it's potentially sort of a problem at a classroom level is the teacher is, in saying that, sort of assuming some of the responsibility, right? A student might feel, oh, disclosed this to my teacher, so they've got my back or they've got my knee, they've got me. When in fact, the teacher likely, doesn't have the skills to do that. Even somebody that's a physical therapist that knows you, if they're running a classroom, they can't make modifications for every single person's back, for every single person's knee condition. That's something that we as individuals, we really need to accept autonomy around that and own that, right? I am somebody living with a chronic disc herniation. For instance, I'm not, but for instance, I know that my back gets really sensitive when I flex it or I load it in a flexed position. So I know how to modify that. I've worked one-on-one to learn how to do that and to get myself back into my class. That really has to happen with a provider in a one-on-one setting. Okay, so that would look like you're working with your physical therapist. You're like, you know what? I love this Pilates class. How can I make it safe for myself? Physical therapists will be very happy. That is our role. That's our bread and butter. We are the movement experts, okay, in medicine. And then the third thing that when a teacher elicits that sort of feedback from students within a class, it I feel like that question doesn't allow people to really engage with the complexity of pain, right? So we know that pain that persists longer than just like 3 months usually has elements to it that are not just biomedical. In other words, not just arising from the disc herniation, not just arising from the stenosis, but have other influential pieces from your life, such as your psychology, such as your sociology. So, when a teacher kind of prompts that questioning, it doesn't really get to the whole truth about our pain or the whole underlying truth about the felt sense in the body. And then just think if there's somebody in class that has a long history of a complicated relationship with their spine and they start to hear about other people's injuries, how might that impact them? How might that set them up for participation within that movement class? I think that that could be a setup for engaging in a lot more fear in a way. I think that's not the attempt of the teacher. The attempt of the teacher doing that, I know, is coming from a good place. I know that they're trying to get out ahead of things and to allow for some processing. But the processing that, again, that needs to be done is quite a bit deeper. It's kind of profound, right? So I don't think that's the safest setting to do it in within a community class setting. So I was trying to think of like an alternative, which I haven't heard before, but if you go to a movement class and a teacher says at the start, I just want to know, does anybody have any underlying, unremitting conditions that might not allow them to participate in class safely? And this should probably be done in a waiver setting or in like a phone call setting. If so, come up to me on the side. I'm going to give you guys, a small exercise to work on or a gentle warm up, a foam roller, something to work on. And then I'll be on the side. We can have a conversation about it because as a movement teacher, what you want to assess, what I think you would want to assess would be how comfortable is that person in understanding how to work with their underlying condition? How well do they understand their condition? Do they know what it is? Do they know what tissue's at fault? Or is this a big nebulous thing? I've had back pain for 10 years. I don't know what's causing it. That's a really different place to work. But if somebody says, I've got this long-standing injury, but I really know how to work it, then they're going to probably be fine in class. I know the things to avoid. I know the things that I want to engage in more to help it get better. I kind of have my toolbox. Okay. So you always kind of want to be assessing what is somebody's toolbox. And as movers, those of us with longstanding, all of us have probably some sort of orthopedic issue. All of us with adult bodies will encounter orthopedic issues. So we want to ask ourselves, what is my toolbox? How autonomous am I in working with this issue, right? In that case of somebody with like a posterior disc protrusion, can't even say it, you know, do they know what movements to avoid? Do they know what to do to make themselves feel better? Oh, yeah, I know at the end of the day, I unload my spine for a certain amount of time, and that helps to restore more normal fluid and motion within the disc. Or I use ice, and that helps to kind of quell and calm some of the muscle, and it helps to move some of the inflammation out. Or I practice diaphragmatic breathing, right? All of us need a certain toolbox, and we need that account to be kind of robust and full before we engage in classes at the community level. Because in order to engage in stuff at that level, I have to tell you, I've been teaching a community class since 2020. People have to be kind of on their game. They have to be able to know how to protect themselves. I do the best I can as a teacher to make exercises safe, to begin at the beginning, right? Sometimes almost to the fault of being like boring and beating a dead horse. But I think that still, even with that, there will be people who enter into my class who have not gotten the basics of knowing how to work with their issue with their particular body. Okay. So just those couple of things I wanted to talk about, hop on really quickly today and say, because it was something that came up with my other friends who are PTs. We were talking about this after work yesterday, and all of us have kind of had, different experiences working with different fitness instructors. But I'd love to hear your feedback. I'd love to hear, if you're a movement teacher, what do you do that doesn't allow people to kind of put responsibility on you, allow that to kind of get a little bit out of hand where you might be unknowingly, unwittingly kind of triggering some of the danger or fear in other people that are participating. Okay. So that's all for today. Just really quick soundbite. I hope you guys are all doing well. And if you're interested in learning about how to start strengthening safely with an understanding of orthopedic concerns, an understanding of exercise physiology and biomechanics, come join our practical strength class. I'd love to have you there. All right. Thanks, everyone. Take care. Bye.